Lord, we ask you to give us a tuned ear and a stimulated brain because you created it. Thank you. You have two documents. One is called Right Learning and Digital Health. Other one is called Digital Setup for Drug Abuse. I was the head of Department of Pharmacology in a state medical faculty, and my research subjects were epilepsy, Parkinsonism, migraine, that is serotonin-based diseases, and few other things like analgesics and so on. About 5 years ago, when I was doing some lectures for schools, this was brought to my notice that students are jittery, and often they can't follow normal classes. So they asked me what is ADD, what is ADHD. My training is in adult medicine, so I did not know much about them, so I checked with the professor of pediatrics, who was my colleague. He said, Lalith, it's like this autism spectrum of diseases we have known for some time. And though we don't know all what to do with it, we know what it is like. But over the last 15 years, we see this jittery behavior of children, and we really don't know what it is. So ADHD is attention deficit hyperactivity disorder. ADD is attention deficit disorder. So when I began to read on it, I began to realize that digital stimulation, that is when you watch the digital screen, the changes that happen in your neurons and in your brain chemistry is quite intense. And I got this researcher's intuition, I believe it was the Lord's thought in my heart, that somehow quite a bit of the jitteriness of modern day school children come from how much they watch the digital screen. So I began to research, I began to write, I began to conceptualize, and I will share some of the conclusions I have come to. And when I first went on the internet or tried to look at textbooks, there wasn't much in this. Now research is coming out quite a bit. And they are confirming what I have been conceptualizing and practicing. It has boiled down to, back in Colombo, we have an empathic learning center where schools refer children who are jittery at school. Jittery is a layman's term, I'll explain what it means. And now parents and many others have got to know about our center. I give frequent lectures to corporate schools and different places like that. So here is an introduction to understand the topic, what makes these children restless or lose their attention. So if you read the first page of this Right Learning and Digital Health document, we will switch between the PowerPoint and you'll keep a close contact on your paper. Now the PowerPoint is really to look professional, but actually people learn in seminars from the flip chart or whiteboard better. You'll concentrate, absorb, and you'll move with the speaker's thoughts much better with the flip chart. That's research. So you will see in my hand note, responding to inattention, impulsivity, and hyperactivity. These are the three symptoms that children manifest. When I say children, youth also can manifest this. So inattention comes because their neurons and brain chemistry has changed so much, they can focus only for a short period of time. Attention span has shortened. Attention depth has become shallow. So attention span is shorter. Attention depth is shallow. So when they are studying the school subject, they go in their brain thinking, I know, I'm bored. Not that they know, it is just that they can't give the attention depth required for that subject material. Now I normally ask people to wave if you understood what I'm saying. So the attention span has got short and attention depth has got shallow. Impulsivity is the way the neurons are now firing. I'll explain it a little more technically. Inside them, though they are in one place, inside them, something is exploding. You understand impulsivity? then of course it will manifest as hyperactivity. The hands go this way, that way, they run in this direction and that direction. That is easily understood. So how is this happening? Let me draw this. In our normal, this is the brain, this is where the eye is, and this is the prefrontal cortex. Frontal cortex, the foremost part of the prefrontal cortex. And here executive action is thought. What is executive action? A little toddler crawling inside a playpen. You have playpen? Inside the playpen. If the mother is in that direction, that little fellow is now crawling. He wants to crawl in the direction of the mother, and he gets that building block into his hand. He goes to the edge of the playpen and he stands up. This is all good for him. Till about the 7th month, it's good to have as large as possible a playpen. It's good for him. He knows the limits, and at the end of it, he knows there's the effort of getting up. Otherwise, he crawls aimlessly here and there. Got the point? So he comes to the edge of it, he stands up and he throws the building block. Then he crawls back, takes another building block, initiation, navigation, end conclusion, successfully doing it to the end. That's how we learn management very early. And of course the reward is, at the end of so many things being thrown, mommy comes with whole lot and he feels very cheered and he gets some safe, healthy thing like whatever. And he feels he's rewarded. So our human brain from very young days need to grow like that. And at that toddler stage, his attention span is a few minutes, isn't it? He picks it up, he goes on doing this, gets up and throws. And he keeps doing that till the reward returns. So very early also, he's developing attention span. Will you say with me, attention span? Attention span. Thank you. So when the child becomes 2.5 years or 3, let's say, the daughter, the doll has to go to school. So she wakes up and brushes the teeth. Whose teeth? The doll's teeth. And doll takes the breakfast and doll goes to school. What's the school? The desk. Your daughter is on this side, the doll is on that side, and the doll learns all the studies she can at that age, and now school is over. Now doll must come home, have a wash and have lunch and go to sleep. And how much would that attention span be? About 15 minutes. You know what I meant? Now 3-year-old is taking the doll to school and doing that stuff. So even at 3 years, the child is developing a 15-minute attention span. So by the time the child is going to school, child has developed a 30-minute attention span, and by year 12 years, grade 5, child should be having about a 40-minute attention span. That is executive, empathic, which means it's good for the child, it's good for everyone else. Creative, correct? Yeah. Reflective, the child is thinking and doing. Pathway, that's how we must be thinking and doing. Now, there's another pathway which involves the amygdala. Shape of the amygdala is like the gallbladder, but it's very small. It's the one that repeats the same thing like vomiting. What the gallbladder does, brings the old stuff up. This brings the old stuff up, and there's the hippocampus, and there's the hypothalamus. Now, since doctors have to remember all these words, they're usually glum, but they remember amygdala. So here, this cycle is also God created to tackle sudden peril or stress. For instance, if you start slipping on a banana leaf, which is quite usual in Sri Lanka because we produce a lot of banana, you know, or on water for that matter, without thinking, your body you try to keep your balance, isn't it? It's very quick, unthinking, you quickly do it. But the digital screen stimulates in a way, this becomes the way you do everything. So what was that? What was this created for? What is this designed for? In stress or unexpected situations, for you to recover, repose and position and get back to normal. So this has bit of dyspathy, meaning in the process of doing that, you may you may hit you're falling, and your grandmother is nearby, you knock her also. You couldn't help it, but you didn't think about it. Did you understand that? And this is troublesome, stressful. It's under dyspathy that you do this. This is a new word that has been coined to describe what happens with children who opposite of empathy. And this is reflexive. You didn't think about it. It's a reflex. This is reactive. And this is repetitive. This was meant for stress. But the digital stimulation works out on the neuronal tracks and chemistry in such a way, you keep doing this same thing again and again. It's as if you are under stress. Give me a wave if you're understanding. So this becomes the flight, yes, fright, fight mode, which involves cortisol, that's the stress hormone, more adrenaline, and more noradrenaline, and so on, at the hormonal level. In the next one, I will describe it at the brain level, neuroscience level, okay? So this is what the digitally stimulated or overstimulated child is doing. This, in fact, is the way that happens with all addictions. Repetitive, stressful behavior, pornography, or PTSD, post-traumatic stress disorder. People go back to the bad memory. Here the child worked for a reward. You remember? He crawled till he throws it and mother brings it back. So that's reward. Pleasure is pleasure. Here you begin to think pain is pleasure. It's not good for you. It's dyspathic, but you are doing it. That's what addictions are about. So now people describe internet addiction disorder and so on, a little more of it later. So this is the anti-reward system that has got recruited, anti-reward system. Did you understand the difference between normal and this behavior? This is the behavior digital overindulgence excites, initiates, and children keep doing the same thing. There's no way to get over it without reducing the digital screen. Now in schools, they are already required to look at the digital screen for studies. Therefore, you have to preserve screen time as much as possible for study. Because already they are using the digital screen quite a lot, okay? Now, you can write down questions, and if you are in this field, if some paper can go around, if it's okay, and if they give me their email, I'll keep them posted with updates and they can interact also. Because there's a developing field in the course of time, soon now, you should be asking those questions that are popping up in your mind. It helps you and it helps me also to cogently present the case and work it out, you know. So last night I was at a place doing this, and they asked some very, very good questions. There were 3 doctors, and there was a real senior nursing officer who's in charge of a lot of mental health training for nurses. So it was a very successful seminar in the sense they interact and then we discuss and we come to conclusions of understanding. Now, this is in your paper you will find attention. This is how our normal brain works. You focus on something that's called salience. You have this statement, come to the salient point. That is salience. Get your focus, keep your attention till it's done. Our brain is designed that for 40 minutes we will do something, let's say reading, and we'll sort of sit back a little. That's how we go. If we are not externally stimulated, we will read something or do whatever, cooking or whatever you are doing for about 40 minutes, and then you take a sit back and you look at it and say, that was good, that was nice. Oh, I think it needs a little improvement like that. And in yourself, you are having a satisfaction how to do it better. So there's a self-check, self-assess, how to do it better. That part comes from a this is the dopamine that gives salience. And this is serotonin, which is sometimes called the happy hormone, though serotonin is not a hormone, it's a neurochemical transmitter. So when you have come to the point, you have done your work, dopamine U curve comes down, and serotonin U curve starts up to give you that 15 minutes of self-assess, recheck, how was it, you're happy, or you will say, I'll do it better next time. Did you understand that? This is how we have been designed. And this is a good thing. Now what happens with intense digital stimulation is that if the child is on the digital screen all the time, this dopamine U curve doesn't get a chance to come down. It goes on. So the serotonin doesn't get a chance to come in and do a self-assess. So we get a generation who want to do the thing and not look back and see, was it good or bad? Do you understand digitalized behavior? So we have to help, and parents and teachers have to work together and convince the child this is neuroscience. So you need to give yourself quiet time to get back to self-check, self-assess, and even feel that was good what I did. When dopamine is excited, what you did is not good enough. You want to get to the next thing and keep it till, it goes on like that. Besides that, in our normal work, D1 receptors, dopamine has 5, D1, D2, D3, D4, D5. D1 is stimulated for us to keep doing that thing. Now, when I am moving my hand like this, now this hand moves by intentional voluntary muscles. But for the intentional voluntary muscles to do this well, there's another system called the extrapyramidal system that works on dopamine that supports this action. Now in Parkinsonism patient, if they try to do this, that happens. Usually Parkinsonism is age-related. That is the difficulty in dopamine neurons. One aspect of that difficulty is, normally it's D1 that gets stimulated, and when you're too much on the digital screen, D2 gets stimulated, and that does kind of thing. Now, brain doesn't make sounds like that, but I'm trying to get you to understand how the child feels. Please give me a wave if you understood that. Now, the tragic thing is, this is exactly how cocaine works. So now they call this addiction, they call it digital cocaine. So my books refer to it. We have a Facebook page called Digital Science. So you have, if you just go to my Facebook profile, I'm Lalith Mendis, you will find different pages. I sort of, for this very purpose, the pages that have been established, posts will come on that, then you can follow it up. Different things that are already been worked out and thought out. So this is called electronic or digital cocaine, because cocaine acts the same way. Okay? So this is salience, and serotonin should be giving satiety. You understand the word satiety? It was good. I should do it better next time. This sense is completely taken out of the child who is all the time on the digital screen. So that is a great disservice, isn't it? This is set there by God. And when you are working like this, work for a while, think for a while, do a self-assess. That is called default mode network, DMN. That is in fact what Psalm 46:10 says, be still and know. So when children are love to be still, or for that matter, adults are love to be still, what do we know? That He is God. You think thoughts after God, as Einstein said when he was sane. So, that children automatically root towards godly thoughts, who they are belonging to their parents, they are belonging to their Heavenly Father. That gets disrupted when the child is put on the digital screen. So when you understand how the digital screen works, you begin to think those who devise all these programs must be intent on disturbing the child's internal ecology. This is not happenstance, the way the child has become the target of the market with so many digital gadgets. So this is about this curve. Now, attention salience, yes. Now this is only neurochemistry, but in actual fact, now thought scientists say behind our actual heart, there's a neuronal complex of 40,000 neurons called the heart brain. You can Google. So when the child is very small, before the big brain is responding, the heart brain is responding to the bonding with the mother. So you get something ticking off first, and this heart brain begins to influence the big brain in the decisions. Big brain asks heart brain, should I do this? And heart brain says yes or no. So obviously this is the old-fashioned conscience which we believed in till Darwin came around. Then we adopted struggle for existence and survival of the fittest and might is right and all that. But still, when the mother bonds with the child gets a real cognitive benefit, where he's thinking better, his IQ is growing better, and he's responding very well. Now, all what you have heard about e-software and e-learning, it does not improve child's cognitive function on the long run. All e-gadgets and e-learning methods saturate the child's brain in the now. He's smart now. But studying, learning and education should be, in the first 12 years, you stretch or you rewire the child's brain tracks for the next 12 years. So e-learning saturates now and he appears smart fast. That's not smart long. Give me a way if you understand that. So many parents also can get deceived once they start on the screen because it's a digital nanny. It's easy to give the child a phone, iPad or tablet and keep him occupied. Then you begin to look for reasons to justify that. And then the market always finds good reasons and fake research to get the consumer to consume what they want to consume. Now this is very prevalent in the medical field, isn't it? Pharmaceutical companies can get you to believe anything. Because in pharmaceutical, that's my field, in pharmaceutical research, lecturer needs to become senior lecturer. Senior lecturer needs to become associate professor. And then the university needs funds. And governments don't have funds other than to make bombs. So university departments don't have funds. So they have to get the funds from drug companies for drug research. So what would drug companies give funds for? To prove that drugs are bad? Certainly not. So that now, some time back, the editor of the New England Journal of Medicine resigned because of this problem. She said all the time there's a push to justify fake research. Now this is in academic fields, So similarly, all kinds of reports will come out how e-learning makes the child brilliant fast, but the child is not getting brilliant in the long run. So the first 12 years of study is to prepare the child's brain for the next 12 years of study. That's the principle of, so this is about the curves. Now if you look at yours, this is there on the slide also, but you can look at your paper first page. Kinds of children. What do I mean by kinds of children? Now, there are children who are impulsive from birth. For instance, when they come to me on a Friday, we have an empathic learning center. So as I told you, schools refer to us, parents refer to us, and we put the children on empathic learning therapies. The problem they come with is that the child is jittery at school, hyperactive, disturbs himself and disturbs others. And the great school that Jerome referred to, our college, it's really a great college, they have, in the first 5 years, they have an ancillary teacher in every class. I'm sure Britain may be doing this. Ancillary teacher who's on the side, looking for the disturbed child and moves towards the child to see whether the child can be given a little personal attention and kept studying. If the child is still disturbed, after two periods or so, he's taken to a special student unit where he's allowed to do, not the curriculum, some little whatever he can, and then maybe after 2 periods there he can return to the normal class. He feels a bit of release and so on. But this is a real problem. So we have to give lectures to teachers how to cope with the child, and to parents. Otherwise, the teacher says, your child is very disturbed, he's disturbing the other children. Then the parent says, that's why we are sending him to school. It's your business to look after the child, and the child will come to school. So there's a lot of, So we try to get them to understand each other's role and how to best cater to these children, because these are not autism children. These are not ADD children. These are not ADHD children. These are children who are disturbed because their digital consumption is too much. Will you give a wave on this? Now, having said that, we find, and other researchers have found this children who are jittery, impulsive, and inattentive at classes, about 25 to 30%, it's from mother's womb. So the mothers report that in the first year itself, feeding was difficult. I had to carry the baby. Putting the child to sleep was difficult. They complain. So 25 to 30% the problem begins in the womb, and when they come to our empathic learning center, we find those children are more difficult to get back to normal than those children who are later digitally disturbed. You understood that? For instance, what affects their brain? Now it is known the PGE2 molecule, prostaglandin E2 molecule, the concentration of it on a certain part of the brain determines which parts of the brain gets wired more. And they have found in research now saying in a certain area, during the season of agrochemical spraying, if a child is conceived, so if the first 3 months, first trimester, comes in the period of agrochemical spraying, those children born during, after that, first 3 months came in the agrochemical spraying season, there's a higher prevalence of ADHD among those children. So what does it mean? Agrochemicals get into the mother's blood, cross the placenta, get into the child's brain, and they do affect the way the brain tracts form. Similarly, there are many other factors. My books have those factors that may be influencing how a baby's brain tract is forming. Did you understand that? So now they think even mother's digital life, very violent movies or very violent music, will cause certain neurochemical transmitters in the mother's blood to cross over and affect the child's brain tracts. So these are new things that are coming out. Quite recently, they even began to prove that simple paracetamol, Panadol, which was the safest for pregnancy. Now they are saying don't tell mothers not to take Panadol ad lib for anything. Because paracetamol itself may be affecting the child's brain tracts. Certainly mothers taking alcohol during pregnancy affects the child's brain tracts. So for 15 years, the British Pediatric Association was asking the obstetricians to advise mothers not to take alcohol at all during pregnancy. But they didn't because of the social implications. But 2 years ago, because evidence is so great that alcohol in any measure will affect the brain of the fetus, the Royal College of Obstetricians have now put out a very guarded statement. It goes like this: we cannot assure that any measure of alcohol consumed during pregnancy is safe for the baby. You understand that PC language, what it means is a mother should not take alcohol at all while carrying the baby. Now everybody knows there's a fetal alcoholic syndrome, and that is when the mother takes a lot of alcohol. This is not about that. This is just simple social drinking. So you can understand how many mothers would have done this over the last 20, 30 years and what effects it could have had on a child's brain. Now some of this research is not sociologically palatable, but this is true. So a lot of parents will have to package this through, and the church is in that pastoral place to pioneer this field, because this is a very needed field, isn't it? Our children are affected, and parents lose their children very young to the digital screen, and churches are losing young people to the digital screen. So it is a primary mission of the church. Martin Luther said, if you don't fight the battle where the battle is raging, all your battle tactics are useless. So this is a real area where parents, teachers need help to package this through, and church can inculcate and incorporate many child-safe measures in children church and so on. That's what we have done in our church. We have dedicated one whole floor for empathic learning therapies and another floor, 3,600 square feet, for empathic motor therapy. That is to say, when you do grips and ropes, it has a medical effect. You understand grips and ropes? Climbing walls, Burma Bridge, it's part of army training also, and it's like gymnasium, grips and ropes. It inhibits, doing grips and ropes inhibits the digital jitteriness. I'll explain it a little more medically later. A wave that you understood so far. Okay, thank you. So that's about how some of these things are playing out. Now we get to, I'll describe a little more these kinds of children. So you understood children impulsive from birth, what it means. Then high IQ children, they need a timetable after they come from school, because their brain looks for occupation. And if you don't give them some good occupation, where will that brain go to? It'll go to a screen. So back in Sri Lanka, what we recommend is, after the child comes from school, let there be a pet, a fish tank. Sri Lanka is very popular about this tropical fish in tanks and so on. Gardening, cricket, of course, it's a far more intelligent game than football, as you know. What else? Elocution, music. So the stringed instruments are better than the keyboards for brain tract development, but even the keyboards is far better than going on the digital screen, because these string instruments, the violin and the guitar, this hard pressure, it is pressure touch, develops brain tracts well. Then clay molding, not merely plasticine is too soft, actual earth clay. Now in Sri Lankan bookshops you have actual earth clay. So getting the child to mold shapes with actual earth clay. Then fitting puzzles, doing puzzles, father doing puzzles with the son, age-related puzzles. So these also become empathic learning therapies when children come with digital jitteriness. Did you understand that? So we are recommending keeping children minimally occupied with the screen for fun and entertainment, because it reduces their attention span and reduces their curricular potential. I'll come to that. So I'm at the point of how to occupy the high IQ child with useful activities that will not get his brain chemistry wrong. Did you understand that? Now you can think in a British situation what more he can do. Certainly in our empathic learning center we do carom, table tennis. Now we don't have a table tennis board, but because that ball returns, you keep aim, you get the idea. So it's about eye, finger, hand, movement, coordination. The grips and ropes also it's like that. If you know what Burma bridge is, you from rope to rope, the child has to coordinately keep the coordination and walk. And he thinks it's thrilling, and they are into thrill, they like the idea. So our 3,600 square foot floor is full of this kind of stuff. So they love the idea. It's very thrilling. Cargo net going up and, maybe I should bring some of those clips. But they're all there. I told you, if you click my name on the Facebook, you will find another page called Digital Science. It has all these gadgets and another one called Thrill Adventure. So my profile have posts from different things just to encourage parents and teachers and churches to seriously consider these avenues to help parents to reduce the screen time of the child. Okay? Any questions right now before I get to the next part? Something that you thought through while I was speaking and you like to ask me? I'll carry on then. Huh? Okay. Now, a little more about these children. Kinesthetic children are those who, from mother's womb, they are wired for a little more movement than other children. So when I lecture in schools, I tell them, keep a row of chairs with room on either side. Then they don't feel claustrophobic. They feel they can throw their leg this way. So that is in a normal classroom. Keep a row of desks with space on either side. They kick around and they still stay in the class to accommodate the kinesthetic child. Then of course you have seen the kinesthetic ball, isn't it? When they're rocking on it, they get there 9 times 9 is 81, 11 times 11 is 121, 13 times 13 is 169. Now, they don't have to go that far, but you get the idea. They memorize better when they are a little moving around. Then the digitally overstimulated children, you understand that. The right brain visually overtuned children. Now let me explain what that means with this diagram, which goes on to our last slide on the first page. 7 brain tracts. This is a functional understanding which is very helpful to understand your children and apply it in education. 1, 2, 3, 4, 5, 6, 7. Now, I told you this is the prefrontal cortex. This is where empathic, intuitive, how the child begins to think about himself. This is called intrapersonal in your handout. You can write empathic, intuitive. You understood that, how the child begins to think about himself. He should begin to think about himself well, good self-image. Then the second one is empathic relational, that is called interpersonal, how the child begins to relate to others. This is normal development. This is how the functional brain tracts develop. So some children are internally processing. They want to think their thoughts through insight. My grandson is like that. My daughter is a medical academic and my son-in-law is also a medical doctor. And only my wife is a lawyer, so we are 3:1 and generally we win. Not really. Not really. We Yeah, anyway. So my daughter lives on the other side of our house. It's separate, but the little fellows keep coming in. So I have a 9-year-old boy and a 5.5-year-old little girl. It's a living laboratory, our house is. So when I think something, I can see how it works out also in them. So he is an internal thinker, whereas Danica, my granddaughter, she understands herself while interacting with others and talking to others. Such a child, you must never say, shut up and listen. They can't shut up and listen. While talking, they are listening. Even in the classroom, they want to respond to the teacher, not because they are disobedient, but that's the way they absorb. And these children who are empathic, intuitive, and internally processing, you must not say, now get up and answer. They are not the getting up and answer kind. They want to be silently thinking. Did you understand that? Yeah. So even amongst your children, little bit of knowledge will help you how to relate to them better. Next track is the linguistic track. Now the American Academy of Pediatrics has decreed that children must not get the digital screen at all before the age of 2.5 years. Did you know that? Because it will scramble speech. Why? Now speech formation mostly happens while feeding and eating goes on. Because feeding and eating is a very intense neuroscientific brain tract forming time. Child sees the potato, mother says potato. And he touches the potato and he gets the shape of the potato. Then he starts eating the potato, and that is the whole experience of learning the language about potato. Give me a way if you understood that. So it's language absorption. And now they know a child under 2.5 years can absorb 2 languages with its grammatical structure without you saying this is English and this is some other language. In our context, this is very useful. They just absorb it and they come out with the English that way and with the vernacular this way because of natural absorption of language. That facility is gone after the age of 2.5 years. Now, you put the digital screen on the child, especially at feeding time. What happens? The digital screen unloads on him irrelevant subject that he can't understand. Too much for his age. And it is scrambled sound. And he loses this vital hand-mouth coordination experience where he is looking at the screen and someone is putting concrete in his mouth. That's not the way to develop a child's brain. So I want to plead, get this message around. Feeding time is the brain best time. Shall we say that together? Feeding time is the brain best time. Make maximum use of that time to improve child's cognitive function. Just a wave if you understood that. Yeah. So that is about linguistic, how the language develops. The fourth one is the logical, mathematical track. That's where executive planning and all that happens. You remember how the toddler himself just, he starts walking to a successful conclusion. So from young days, this track must be developed. Now another thing, see this, when you are giving the child the flat screen, it's just a 2-dimensional flip action. 2 into the power 2 is how much? 4. Whereas all of natural life, seeing and touching is 3-dimensional. He sees 3-dimensional. A child who would normally see 3-dimensional by walking around is now stuck in one place. The screen is smart, child becomes stupid. What's happening? 2 into the power 3 wiring process is reduced to this. How much reduction is that? 50% reduction. So I really think putting the child on the digital screen is really child abuse. This is a very sad thing. So we have to get this around to parents. It is true that in modern stress, father, mother both working, you have to find method of reducing the screen time somehow. And certainly before the age of 2.5 years, please don't give the child the digital screen. Now it is known even if a breastfeeding mother in the first year of life or a mother who is bonding, if the mother is on the smartphone, this fellow knows he's not being attended. This is research. And his cognitive scale drops. So it's a thing, So we have to listen to science, isn't it? So we have to encourage them in church time and in whatever talks, how to reduce the screen time of the child. This is a necessity of our time. So these are the do tracks that helps us to do the work. Then we have 3 other tracks: kinesthetic, acoustic, and visual. The visual cortex is right here. Now everybody needs each track, everybody needs. But depending on how the brain wires and what you are feeding the brain with, some tracks get dominant. So what does the digital screen do? Cartoons, the pixels, this is my next slide really, but I'll mention it now. When you are normally browsing on your laptop, your normal schoolwork, pixels are minimally used. But when you take a smartphone or iPad or tab and doing digital games, pixels are maximally used. Then now smartphones are about 550 ppi, pixels per inch. There was a time when smartphone screen surpassed the retinal. You remember? Retina is 247. That is counting rods and cones. So retina is a kind of digital screen, not a digital, a neuronal screen. So when that was surpassed, whenever a smartphone is at work or a digital screen at work, retina is under stress to catch up. Did you understand that? Then depending on what you are doing on the screen, now very violently moving cartoons. I'm not talking about violence. When cartoons are hectic, you know what I mean there. Colors are changing, maroon, black, purple, luminous, green. Or the digital games which are even more intense. Then the pixel influence on the brain is far more than your normal browsing of your laptop for schoolwork. Did you understand that? So we have to make an intelligent pitch to children. Preserve your screen time for your schoolwork. That's what's going to give you a future. If not, they'll overwire the kinesthetic, the acoustic, and the visual. It's not only that, every neuron I'm trying to draw a neuron. Neurons have a neuron will have many dendrites and one axon. At the end of the axon is the end. This is where the action is communicated. This is where the sensation is received. In normal, at the end of this axon, it may be dopamine, or it may be adrenaline, it may be noradrenaline, it may be an endorphin. Those are different neurons in different tracks for different functions. So, in the normal brain, neurons are into unidirectional preferred mode firing. So, they receive an impulse only in one direction and send the action. That is physiological homeostasis of the brain. What is homeostasis? The usual state of the brain. Okay? Now, when the kinesthetic, the acoustic, and the visual is so bizarre changing in a given second, what happens is one neuron tries to receive so many stimuli. Then the neuron is in multidirectional, non-preferred mode firing. That is the jittery behavior and the impulsivity of the child exposed to the digital screen too much. Did you understand that? Just give me a wave if you understood this. So in Sri Lanka, we are recommending every church to have someone who is able to teach this much. Obviously, if they have a medical background, it's helpful, but you can see this is not, enormously difficult. Anyone going through this can easily teach, become quite adept at taking a mother's class or taking a young people's class. I have brought a pen drive also, and my books have quite a lot of this description. Besides, I am on YouTube, it's free. You can get there and listen to as much as you can. So, we have to get, so I speak to A-level, O-level, you have A-level, O-level here? A-level, O-level students, because they are the older siblings. I speak to them saying, look, what your sister and brother are seeing now is far worse than what you saw 7 years ago. You have to interact with them because they don't listen to parents, but they better listen to older siblings. So you have to watch your digital life. So at schools I tell this, so that you can help your brother and sister, but they're exposed to far more injurious things. Now, though the digital games are age-gated, trailers come from a higher age, and it has, what it has? Violence, blood, sex. Now, besides the content, I'm talking about the pixel screen itself, its effect when you're too much on it, okay? So this is how to preserve a child's unidirectional mode of firing, not allowing it to get multi-directional. Yes. Any questions at this stage?
So, am I right in thinking, so if a particular part of the brain, so 4, 5 and 6 gets overwired,
yeah,
and that's what they've set themselves up for the future?
5, 6, 7, yeah.
5, 6, 7.
Exactly.
They're overwired, so that's what they'll respond to.
2. So let's...
So it's a permanency.
It can be changed. Let's say when I see a child, every Friday I see these children, I can say this child is mildly affected. Right. Will need about 6 weeks of empathic therapy. This child is quite severely affected, may need about 6 months. So what does empathic therapy means? Getting the parents to understand that they have to attend on this. So often the mother wants to come, but my secretary will say, no, the doctor will see only if father and mother both come, because he has to go and implement it at home. Father gives the child the next stretch. Mother makes it safe every day. That's how it goes. So he has to get involved in this. So we give advice like that. So if they overwire kinesthetic, acoustic, visual, there's a disco going on in their head. This is the principle of the disco. Even if you are not the dancing kind, you go there, you see the gyration, you see the LED lights, the visual, and you hear the acoustics, you will feel like doing that. So the child's brain goes on like that. So what happens is, these are management tracks, these are the show tracks. So do you need a world full of people doing work or showing work? Doing work. But over the last 20 to 25 years, you will find many university courses now have to do with fashion, decor, entertainment, journalism, lots of that. Now, we need some part of people for that. But the whole world can be a stage, of course, but all can't be doing the same acting. Paths must be different. So these tracks help you to get into management, professions, engineers, doctors, teachers, nursing, whatever. These tracks, when overwired, you are only thinking of that show kind of work, which these tracks have got dominant on. So why gens became like that? But iGens are completely out there on the digital screen. So to occupy them, you have to create a digital world. which some have called the ash screen, meaning it's really not there. So you have to keep creating a digital world that employs them, that engages them, and some are not doing anything else but digital games. So another world has been created. That's the way the market goes. For drugs or for digital stuff. They're just creating more drugs. And now in the medical world, of course, they are defining more syndromes so that drugs will have a market. Once upon a time, you manufactured drugs for the disease. Now upon a time, you manufacture diseases for the drug. So, same with any other marketing thing. So, iGens are now, they are real reality, not the virtual reality, is on the screen there. So, you have to create a world out there to accommodate their interests. So parents have to count the cost and see how do we get them back into professions, whatever. The whole world can't be a show world, isn't it? So that is a serious curricular aberration that has come. So now over the last 20 years, universities accommodated with different new curricula. Now that is saturated. So iGen are moving beyond what those curricula can provide for.
Do you mean Generation I?
Generation I. Some call this the Z Gen, some call this the Y Gen. So Y Gen at least can be occupied in their fields, theatre, cinema, entertainment, graphics, fashion, decor, interior decor, they got accommodated. The world could adjust to accommodate them. But when you're totally digital, you have to create another world to accommodate them. Otherwise, they'll be doing nothing on the screen, online, nearly 24 hours, disturbing their sleep. So it's a medical problem. Yeah, so that's how it is. So the church has to really think through, how do we sit and launch a task force? How are we going to attend on this? What can the church do to have more inclusive things that parents will not lose these children will not lose their curricular potential, So crossing from 12 to 13, the child, you have to really have some serious discussion on. So not that we have all the answers, we have at least started thinking. So sometimes you have to, when children come to see me, I am thinking, Lord help me, Lord help me. Then of course in our Empathic Learning Center and Empathic Motor Center, all our staff is trained to pray. So Muslims come, Buddhists comes, Hindus come, whoever comes, they get prayed. So we do get very gratifying results. Schools report back, parents come and say child's behavior has improved, grades have improved. So it's very rewarding, but it's hard work. We lay hands and pray, we do all that, besides the very technical things we do. So our staff is trained by us. Some began soon after school. This is not an elaborate technical training process, but certainly this amount of background knowledge is needed. So churches have to think of giving enough time for children ministry, children church, with innovative measures that will affect now their study patterns, their character. Church has to get involved in this. That's my plea in a lecture like this. But when this is pitched for the secular world, I have to do like a secular lecture, So now the police come to our place for training lectures because they found some time back children from good families, good schools are getting into crime. Why? They thrill. First the digital thrill, then peril. Then one day they want to break the law and see how that thrill is. So they are organizing petty crimes and they are not expert in crime. They get caught. So that's because of the thrill adventure part of it. Any questions?
Could I ask, it's somewhat beyond just the younger,
Yeah.
immediately younger generation, but just looking at the effects of this on just the activity of the brain and the ability to absorb more, would you say therefore it's the influence the digital world have created that, for example, taking students now who are at university level, whether they're undergraduates or postgraduates, it seems to be an acknowledged fact that many of them, if not most, when they are looking for employment, employers are saying that the two things that students lack now very seriously are, one, the ability to communicate well, and two, a very, very serious lack of the ability to apply critical thinking. In other words, there's no depth or ability to argue points. Would you say then it is this that really has caused such a general problem in that area?
Yeah, my conclusion is that, and which came from here, where they apply salience, conclude something to the desired end. So there's a generation of people who don't finish what they start, and when they conclude it 40 minutes, then the self-assess, self-check criticality comes into play in a safe environment of you are checking yourself. So when you get confidence about you checking yourself, when your senior is checking yourself, it's not a problem. But you yourself check yourself. But you lose this critical sense, then everything else looks like criticism, rejection, I know what I'm doing. So that's the common phrase. So we have to establish this attention span. While I'm here, if even at any age, if you apply the attention span for 40 minutes, read for 40 minutes or do whatever you are doing for 40 minutes. If you are studying an article on your laptop, do it for 40 minutes. Don't go here and there, Instagram, Facebook, whatever it is. Then you get into a multitasking milkshake brain. That's the name given to that brain. So you understand what it means. What it means is this brain all the time has more than 50% of neurons committed to a repetitive circular, you remember at the beginning? Your neurons are in this world not available for rest of cognitive procession. Can you see how much of capacity you have lost? Because 50% has gone to the repetitive thing. It's not doing anything but that. And it draws you back again into that. So that's how, even at your age, if you keep your 40-minute span, it prevents Alzheimer. 2, working in 2 languages prevents Alzheimer as much as possible. This is new research. 3, you do handwriting as much as you can. Handwriting makes brain brilliant. Now, research shows that top CEOs, in the morning when they, first things they do and plan, they handwrite on a notepad. Then only they'll put it into their digital gadget to remind. Because when you handwrite, you think better. In fact, when I do lectures this way, I think better, and the presentation comes much better than me doing chick, 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 chick on that. Handwriting improves your brain ability, cognitive ability, lifelong. So when you read the Bible, this is called the proper Bible, you know. Yeah, there's another one there. So for memory, I'll come to that. Recall, connection, collation, all that involves reading off the printed page. This is a different subject, but allied. So my advice is, after you browse, select the 2 or 3 best articles, get it on solid print, underline, notes on the side. That's how you remember. So research proves that people who are doing notes on their laptop while the lecture is going on remember just 30% compared to those who are doing their handwritten notes while the lecture is going on. And handwriting, at least total content of handwriting for 90 minutes a day prevents Alzheimer. So one place we can easily do handwriting is your journal notes on your morning Bible meditation or anything else, As a habit, do some handwriting. These are the same empathic learning therapies we do for digital reversion, getting their tracks back. Also these things you can do to keep your cognitive function. Now it is known that if you keep your muscle bulk, Alzheimer tendency is less. Why? Simply because you are moving your joints. Now see, when I close my eyes and bring this finger, will this come to the tip of my nose? Will it? Yes, it came. That's called proprioception, spatial sense. So when your fingers are moving on grips and ropes or in any other exercise, your brain tracks keep their infrastructure. Did you understand that? And handwriting is unique to Homo sapiens. Nobody else does handwriting. That is our brilliance. So don't give up on it. Because world over, children say, I hate handwritings. I think Americans are trying to do away with the cursives. Did you know that? The flowing hand? They want to just do it with the block letters. Now, flowing hand is the spatial thing in our life, which keeps brain tracks doing well. And in children, if father would sit with the son for mechanoset, you remember mechanoset? Screwdriver this way, spanner this way, that's how brain becomes brilliant. So we have to get this back into children's life. Now, Lego is better than screen. Anything is better than screen, isn't it? Lego is better than screen, but it is also limited. But the mechanoset is really brilliant. It goes this way, it goes that way, but someone has to do that with the child. So these are then take aim games. Take pool, billiards, snooker, carom, I told you this before also, archery, take aim games. Lifelong doing those things keeps Alzheimer away, and also it's a therapy for digital overstimulation. Any other questions? If not, we'll, yes.
Going back a bit, but what you're sort of talking about sounds quite similar in a lot of ways to attachment disorder. And I was wondering whether they're just two things that have a similar impact, or whether too much digital can actually impair ability to form healthy attachment.
Yeah, probably it is connected, isn't it? It probably is connected. A few practical hints on the third page, good cartoons. Now we have a slogan, third page of your primary doc, good cartoons are cartoons that children don't see. So that's a hyperbole, it's an overkill statement. Meaning, reduce cartoon time as much as possible to 30 minutes or less. Why? If the child watches the pixel screen for more than 30 minutes, though he goes away from the pixel screen, the neurons go on still doing that. Did you understand that? So plead with him, son, only 25 minutes. 2, every other day. Because anything you do daily becomes a habit addiction. Smoking, nicotine, pornography, alcohol, anything becomes an addiction. Yes. Even criticizing the Prime Minister daily becomes an addiction. So we really watch this back in our country. Christians can't afford to badmouth. Because so many people are saying things, by the blessing of the righteous, a city is built up. And if the righteous get onto the other track, the addictive, repetitive gallbladder track of criticism, bitterness, bad words, how can we uphold a nation, isn't it? Yes. And never the same cartoon, because children get very soon brand loyal. Quickly they get brand loyal. And children should be brand loyal only to parents. Otherwise they'll give their life to Ben 10 or whoever. So the parent himself, herself, has introduced an alien into the child's life, very young. And lifelong, he'll believe aliens, outsiders, more than you. Who created the problem? Parents giving the screen so early. Then don't give the light paraphernalia, stickers, the bottles, the Ben 10 watch and whatnot. More you give substance, it becomes a substance addiction, feeding the main addiction. So when the child is watching cartoons, don't give the same kind. Give other things, some other bottle or whatever. Not the same kind. And of course, violence in cartoons, spooky cartoons, and cartoons have a lot of magic. You know that God has created a child to grow in wonder. So the butterfly is a wonder. A blooming, flower blooming is a wonder. First few steps. Children. And with children, we again enter second childhood because of the wonderment children showed. Now, when the child is used to this magic stuff on cartoons, most cartoons have sudden appearance, sudden disappearance, and the child, then child is in a mode of, so what else do you have for me to get thrilled? Nothing is a wonder. And that wonder is what creates numinous awe, sense of awe. It's all gone. Because the digital screen has saturated them with the bizarre. So you are quite losing the spirit of the child, which should be filled with wonder for God and wonder for God's creation and so on. So it's a tragic loss. Yes. Then I have missed out putting this down. Anything done after 6 p.m. on the digital screen affects your melatonin secretion. I take it up again in sleep. I think the last one is on sleep, I'll take it up. At this stage, I can tell you anything done after 6 p.m. has greater effect than what the child does before 6 p.m. on the digital screen. What effect am I referring to? The digital toxicity effect. Did you understand that? So you have to plead with your child after 6 p.m., please don't. So whatever quota of digital screen time, you give it before 6 p.m. Now I repeat, anything doing normal studies on the laptop, going through normal articles, is a different thing from doing digital games on iPad, smartphone and tablet. There has to be some national movement when schools are insisting on iPads and tablets, telling them, if you insist on the screen before the age of 12, please do it with a laptop. Because the laptop has the LCD coming, underlying layer is the LED, and the laptop has the LCD on top. Whereas smartphones, tablet, all have the photons coming directly on the retina. Now, Google Manfred Spitzer, he's a German professor. I am on the topic, the direct effect of the LED screen. Manfred Spitzer. He said in 1992, early as that, don't give children the digital screen for study before the age of 12. He's a famous neuropsychiatrist in Germany. So Germans for a long time did well because of his research studies. And they use Ritalin minimally, methylphenidate, minimally. Because they understood the problem can't be solved with drugs. I'll come to that a little later. Manfred Spitzer, Spitzer. So having said that, schools now push for different digital gadgets for normal study before the age of 12. So some learned people in Britain will have to get together and at least shift to the laptop rather than tablet and iPad. So that's a long shot. What parents can do is keep screen time only for studies. So it's a very difficult situation. Child uses the iPad for normal studies, and in between he'll immediately slip to the digital games. But you can try. So this is Manfred Spitzer. Empathic learning remedies. Before I do that, shall we go to sleep? I mean, shall we get to studying sleep? Last last slide there, blessing and neuroscience of sleep. So anything after 6 p.m. on the LED screen, the blue frequency is largely emanated from the LED screen. You know that. So for night lights, you must not use LED lights because when you get up, you will get sleep disturbed. Immediately melatonin goes down. They are saying the most night-friendly color is orange. That has minimal, so your toilet light or any night light should be orange colored. That minimally affects melatonin secretion. And don't get up in the night and look at your smartphone to see how many WhatsApp has come or whatever. World will not crash, isn't it? Get back to sleep immediately. Then of course you have to prevent your child taking your smartphone to the room. Now all the children thought this enemy has come from Sri Lanka and he's... So these are not unnecessary battles. All researchers say this. Try to do your best for your child not to go to the room with the smartphone, iPad and whatnot. The whole night they could be doing that. And doing it under the blanket without normal light is more injurious. So whenever you're on the screen, have a good bright, not LED light, any other light, lit on, so that you are not using the screen light to see, because that's pure photons. You understood? Yeah. So there is still sleep time. So if about sleep, our sleep should have 4 cycles of REM sleep, that's where you see dreams, rapid eye movement sleep, and non-REM sleep. If you get 4 cycles, that will be good quality sleep. Usually this is between 12:30 to 3:30 or so, and 15 to 20 minutes each cycle. Understood? And if you want to get this sleep, you have to go to sleep at least by 11, and by 9 o'clock, shut off the screen. Then you'll wake up in the morning feeling refreshed. So during sleep, God has His own Dreamweaver program going on in the mind. Melatonin is secreted. And then there's a system in the brain called the glymphatic system. You have heard of the lymphatic, isn't it? There's the glymphatic. Glial cells work on these neurons, and this, let's say there's a neuron. When they work through the day, they develop like spikes. And at the end of where the receptor is, there are sachets of unnecessary chemical. This system works to clear all this, and you wake up in the morning feeling that refreshing, memory settled, recall is good, and all that. When you don't have this quality sleep, you wake up in the morning grouchy. You want to pick up a quarrel with someone. You say, can't go to school. In our country, we say, did you get up from the wrong side of the bed? Do you have that in this country? Yeah. Where sleep wasn't what it should be. Okay? So this is to preserve your sleep time. You have to come to an agreement, a friendly agreement with your child that smartphone in the room is not a good idea. But they'll go on doing Instagramming and whatnot. They'll be working with the screen. And now parents come to me. Some fellows till morning, they have fallen asleep on the sofa with the laptop open. It's such a problem, They have stopped going to school. They're on Xbox, PlayStation, virtually 24/7. Not even eating. Not minding their clothes. The problem is worst in South Korea, you probably know, and in China. But in Sri Lanka, at least 5, 6, 7 parents have come with their children, and the problem is 4:1 male-female ratio. So the male brain is more affected by this digital stimulation. So that proves the point again that males are the problem. Yes, sleep. We need to be in deep sleep. During dream, brain runs a software program. In deep, healthy sleep, child's character grows and brain neuronally refurbishes. In sleep, new baby neurons are generated. So that's why you must preserve sleep for improved cognitive ability. You have to plead with your children and say, look, every day you break sleep, you are ruining your future curricular potential. Sleep restores melatonin. I am almost done. We are going to the second paper. Any question before that? Yes. Yes. Yes.
And also the question of reversibility, whether you see structural and biochemical reversibility,
Yeah.
whether it's possible to reverse the physical effects or
Yeah.
digital.
Yeah. 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 As you know, now most research show that brain is plastic. That means lots of things can be reversed. Thank God for that. Outstanding example was a young executive. He was an outstanding Christian. He backslid. His parents are deeply committed Christians. Father is a medical doctor. And one day he suddenly got a massive left-sided stroke at the age of 27. There's a syndrome, stroke of the young. Retic count goes up, red blood cell count goes up, plasma fibrinogen goes up, gamma globs go up, and young fellows get strokes. So he got a stroke, and his life was saved with great difficulty. He got arrhythmias because the hemorrhage was so great. The right side was shifting, pressure was increasing. I think prayer and the parents' prayer, the whole church prayed, and he recovered. His life was saved. But his motor function returned somewhat, no speech. No speech. So he was at home 6 months, 7 months, no speech. His balance was okay, and even the grip was reasonably okay. His school friend came and started playing on his own guitar, Amazing Grace. And as he was playing friend was playing Amazing Grace, this chap who had no speech for 6-7 months blurted out with the words of the hymn. He sang Amazing Grace. From that time, his speech improved, speech therapy, everything. Now he's married, he holds a job, not at the same level. He was quite at a brilliant level, brand manager of an international company. But now he's at a lesser level, but he's employable at that level. So that is a physical injury to brain. So in our own work, we find those who have been affected in the mother's womb for whatever reason, it's more difficult to get the jitteriness out. They are the ones who get diagnosed as ADD and ADHD. So we try to inform the medical community, parents and everybody, if your child shows the symptoms of impulsivity, inattention and hyperactivity, don't go for drugs first. Go for empathic learning therapy first. Now that's well recognized. Empathic learning therapy was formulated or conceptualized first by Dr. Daniel Amen. That's our Amen. He's Jewish in origin, so his name was Daniel Amen, and Dr. Peter Brenning. You can refer to their studies. We also picked up from them. But doing grips and ropes, I conceptualized it on the basis, doing grips and ropes and small muscles, these are pyramidal tract, voluntary muscles. You involve the glutamate tract. This is a bit of medicine. Glutamate tract. As much as possible. And glutamate tract inhibits the dopamine jitteriness, which the digital screen promotes. So that's why grips and ropes work. Now Harvard has published a study called FITS, F-I-T-S, saying this works. They haven't given the concept I have given, but they have proved that it works in a clinical control trial. Now I'm not in a medical faculty now, so I do it by just clinical practice. But it works. So, as I said, children affected from the mother's womb, it's difficult. But children who are merely digitalized, definitely in 6 weeks you can get them out of it with this full curriculum. Don't go for drugs. We have to plead with parents, schools, I say this, because school pressurizes saying the child is disturbing the class. You have to get the child out of school. Now that no parent must agree, because this is not even autism. This is not Down syndrome. These are normal children. Digitalization has made them jittery. Now we have to get the information to schools also. You shouldn't be saying that. You must have alternatives to accommodate jittery children, because jittery children is a fact of life now. You have to have ancillary teachers, a special student unit, then refer them to empathic learning therapy centers, and by all means stop them taking drugs. Why is it an oxymoron to give drugs? Methylphenidate works on receptors. So when you give a chemical, receptors downregulate. This is basic pharmacology, which means receptors shut up. So to get the same effect, you increase the dose of the drug. Then that drug loses its specificity of the receptor. So methylphenidate is supposed to act on the post-synaptic alpha-2. If you give methylphenidate in minimum possible dose, 2 milligrams, only in the morning, child's morning performance in the school will improve. Not daily, never at holiday time. So there's a very limited use for methylphenidate at a very small dose. 2 milligrams in the morning during school days, his attention may improve. But nothing in the evening. Once the child comes home, parents have to have some way of improving his attention, applying empathic learning therapy, put that other timetable, gardening, pet, whatever. Moment you give external chemicals to an internally chemically disturbed brain, it's a contradiction, isn't it? So on first principles, methylphenidate therapy is ridiculous. But then when the market gets to it, ridiculous things become happenable, they go on with it. Yeah. Then in your second paper, which actually I did for how the digital stimulation sets, did I answer you adequately? Or?
Could you say something about study patterns?
Yeah.
What would be a good recommended sort of evening of study, say, for a student? You mentioned
Study patterns.
40 minutes of study and then a break. Is that
Right. So now recent research study says if you keep the smartphone without using it but at hand where it is visible, it is still affecting your cognitive function, because quite a lot of your neurons are helping you to stop, don't use the smartphone. This is absurd, isn't it? You are not using the smartphone, but it is there, the possibility of use is there. About 40% of your neuronal strength is going to stop you from using the smartphone, because your pleasurable thing is to use the smartphone. You are undergoing acute displeasure in not using the smartphone. So all the displeasurable neurochemicals are at work. Because for you it's stress, the hard, the persecution, the torture. I feel like I am burnt at the stake like who are those two bishops, Cranmer and Latimer. No, I'm just joking, but actually the research reason is that because you are undergoing acute dyspathy in not using this. So they are saying you have to keep it completely out of reach. Even then the first 10 minutes, he's having this battle, I should have had it. But then you settle down that it is not there. So we encourage them to study for 40 minutes. then if they are so used to it, just come and check your WhatsApp or something, but at least 3 hours, no gaming. No gaming. Because brain remembers what is most energized. So you study this wonderfully interesting history lesson about Henry VIII, who had so many wives, so he left the Catholic Church. You know. You're studying this, just imagine. Very interesting stuff. And then you go for gaming for 10 minutes. What will the brain remember? Obviously the gaming. So you have to give at least a 3-hour window of no gaming if you are to remember 2 hours of study. You got that? So after you study 2 hours, next hour play some cricket, throw your limbs around, do grips and ropes. You know what I mean? Not the smart screen, not the screen. Then just allow yourself about 15 minutes for, still I have to say, not digital games, WhatsApp or SMS, Instagram, Facebook, you know, that light kind of activity. And then start studying again. Again, then I have already said after 6 p.m., anything you do with gaming has more effect than before 6 p.m. So church has to get involved pastorally, help parents to keep vision, not to cave in, and parents not to fight the children, but please take some of my books. They explain at length. If I have altogether 5 books, one important book I haven't brought, but I finished it yesterday. So I may have to send that, the green book on right learning, which has so many things about learning. I have a grey book on parenting in a digitally dominant age, this one. This one is the right learning book, which has this what I am talking right now. Maybe I have to get some copies. Then I have 2 other books, Mom and Dad Mistake Management. That is in short sections for you to read it with your child from the child's young days. It's a readable thing. The section you and the child read, and we agree at the age of 3, 4, you agree, darling, this is how we set about life. Mom and Dad, Mistake Management. Other book is Child Heritage, that's Children Are Heritage, that's a bit of a stirring mission call to the church to get involved in the problem, not to think it's a doctor's thing, not to think it's an educator's thing, it's a church's pastoral responsibility. Okay. Is your brain saturated or you still have some oxygen in your neurons?
Can I ask a question?
Yes.
We have a lot of conversation tonight about helping a child and dealing with a child.
Yeah.
And this will make my husband smile. What happens as parents when we're setting the example to our children
Yeah.
on the use of digital? Have you done any work with parents in actually being role models for their child?
Yeah.
Because really in today's age, you know, it's a case of don't do what I do, do what I say, but there's that principle that there's almost a rewiring of the parent's brain
Yeah.
for that to happen for the child.
Yeah.
So I'm
Yes.
just curious, have you, in your
Yes.
emphatic learning, has there been anything directed purely to parents?
Yeah. Can I also ask if it's okay to send around a paper for them to write down their email?
It's gone.
It's going on. Yeah. Thank you. Answering your question, at a certain point in my lecture, I ask, in your home, is there a 40-year-old boy who's very addicted to the digital screen? I always ask this question. Then
55-year-old.
is it possible? So all the ladies laugh at that stage. So this is a real issue. So you have to no phones at meal times. Steve Jobs' principle, isn't it? No phones at meal times. And you have to keep a good... I heard this recently. Someone was speaking and said, you have to keep 1.5 hours of your daily time for your children. And he proved you can. So fathers, there were 300 fathers. There were only fathers, so they didn't have to get intimidated. They could ask all the questions. because they have only men, So it was a fathers' conference. And the speaker was Kasi Kustans, the world needs a father person. And one young executive said, I have no time, I come home tired. He said, those are two lies. I'll show you how you can redeem time. You are not tired. When you come when you come home in your vehicle, before getting down, now spruce yourself up. I'm not tired. Best 1.5 hours of my day is coming. So he really demonstrated, and he went on about this, how to be fresh at the end of a working day for the sake of your family. And then one part of it is that you do all your calls, he said, get a hands-off thing, all your extra calls while driving. Now in Sri Lanka, of course, we have the luxury of someone driving you. So I do a lot of calls and stuff when I'm being driven. In fact, now I don't like to drive because so many things are going on in my mind. I like to use that time. So there's certainly no doubt about this. They have also said when fathers have got involved with a child for 1.5 hours under the age of 5, that child's cognitive function goes to, higher percentiles. These fathers, now normally you think 0 to 5, what have fathers got to do? But they have proven this from research. Do you need any more home encouragement, or did I?
I understand the encouragement and what's there.
Yeah.
But I'm just wondering, in today's age, is there something in place that you have used to retrain the parent?
Retrain the parents.
Because that's excellent. Spruce yourself up, position yourself, be ready to interact. And being church, to be able to be positioned in today's society, how do we position ourselves to say, okay, parents, let's retrain you. Let's give you an opportunity to come and be there. So my mind is just working.
All my lectures I emphasize this principle: father, mother makes it safe every day, every hour. When you come home, you must have the next stretch experience with your child. Plan it and come. Today, my next stretch may be just doing a little walk. So I recommend both have bicycles and cycle together. And those early years, get the bicycle that has wheels on side to balance. The day that he can cycle without the rear wheels, then the proper bicycle. Be in the child's life, I'm telling the father, in all those transitional stages which look simple, but they are the ones that's making the man to come. The father was there always in his next stretch, gave him confidence to face a hostile world, frontiers. Then recently I did this model. I need 5 men. Can I have 5 volunteers? 5 men, yes. Thank you. I have to make a quick judgment on age. Can you please come?
I'm the youngest.
Yes. This is the father of influence. And that is the father, the Lord said, He blessed them, father in the age of fruitfulness. Will you say it in fruitfulness? Give him a good point your that's right, blessing hand and say, fruitful. Fruitful. Now, he's growing fruit. Just beg your pardon, yes. A prophecy. And this also display for any young lady to choose him. Asian pastors are always marriage brokering. That's part of the pastoring. Now, I think this is the stage of growing the tree, multiply. Will you say it me, multiply?
Multiply.
Fruitful. Now he is growing trees. Each child he's growing a tree. Each child is a tree. So what is difficult, fruitful or multiply? Now the child is 12 and beyond. Now he's really multiplying himself. He's understanding that my future is about multiplying my child, growing the tree to all its fullness, isn't it? Now this is a kind of pitch and vision you can give a father. He is fruitful, this is multiply. A lot of work involved. You can't be hands off because he's now 13 and he's on his own, and that is secular rubbish. Biblical pattern is multiply time is very important. And this is success time. So, just going by the, I think,
Bless you.
I think this is success time. And if I had your son or daughter, I would have, he's now shoulder high and he's growing perhaps taller than you even. So you are seeing it. This was hard going and growing. This is success. 3 children, 4 children. He has grown to your shoulder size. And this is really, you are full and you have fulfilled this present mandate, and that's called success. You know what I'm quoting? Yeah. I'm quoting Genesis 1:28. Yeah. And this is success time. For success time is dangerous time, midlife, and then David should have gone to war. It was springtime and he was very successful. He had come to success time. God had given him, quite a bit of success, but you know what happened at that time. And we don't want to go that way. So you have defined success as every tree in your plot. Now we bring in your business, profession, your juniors in the profession. They're also trees. At that stage, you're not thinking that much like that. Now your own biological progeny and your juniors in the profession, you see them growing and you say, this is very good. And who said this is very good? God said. And you're sharing God's heart. Your portion is filled and fulfilled. Then comes stewarding time. Now, he is safely past the naughty 40s, so to say. I mean, no age is that safe. Till we go to glory, we are in a world of, we have to keep our guards and whatnot. But now this is stewarding time. He's all involved in now. He got an inheritance. He packaged his heritage. And he's now all looking at the legacy he's stewarding. And then he has gone beyond that. This is influence time. He's looking at the process of what's happening, and many like this are under his fatherhood in the church, in the company, in whatever field. He's a father of influence. He has no more competitions. Everybody knows he's a man of what is influence across the generations. Now, these generations are not 40 years, changing seasons of fatherhood. So this is a model. Recently I have sort of demonstrated this. I have a clip on this. So each one knows where you are, isn't it? So when you are filled and fulfilled, you are thinking, that's the time now, what do I do? You want to move on to stewarding the legacy. So this transition is quite important. And here the transition is, you may end up here quite dissatisfied with what has happened so far. Then of course you have to package it pastorally and so on as far as a Christian environment goes. So that's a little model that, will you give...
Yes.
Yeah. I need to look at just one slide before we disband. On your second paper, first page, digital stimulant effect has 5 components. Did you see that? Your second paper, which is digital setup for drug abuse. So I have given there what makes subdigital toxicity. Time length of exposure. Pixels per inch on your screen. More the pixels, more the toxicity. Rate of pixel change in a cartoon frame, in whatever you are watching, how much the pixels are changing in a given second. As I told you, normal browsing of a normal study document doesn't involve so much pixel change, isn't it? Intensity and variability of sound and color, that affects the stimulation. Time of exposure effect is more after 6 p.m. Multitasking, sleep deprivation. So our clarion call is preserve screen time for essential study. Okay? Then let's go to consequences on school life, page 2. Attention span and depth decrease, page 2. Boredom, inability to focus or concentrate. Chronic fatigue syndrome of the young, because they have been doing so much of digital stuff through the night, they end up in the classroom sleepy, no more dopamine. Then when you give methylphenidate, they improve. So first 3 months, wonderful results. That is Ritalin. Then you have to increase the dose, because I told you receptors downregulate. Then other side effects come. Then they prescribe drugs to stop the side effects of methylphenidate. I have seen 10-year-old child with 7 psychiatric drugs. It's a tragedy. Yeah. So we must not go that road, isn't it? Recent research article is out about how the psychiatry field and the pharmaceutical industry play ball with each other, So it's when benefactors are not benefactors, whom can people trust, isn't it? So that's the issue of present day life. Learning is uninteresting, regular is boring, fantastic is the craving. So they're always for the next fantastic thing. Thrill-seeking behavior, recruiting anti-reward systems, pain become pleasure, isolated selfie behavior. They need empathic motor therapy. Just simple crafts will not do. You have to get them into grips and ropes in a medically prescribed dose, so to say. Daily, if they can do it, good. So in our center, we are inviting dad and son to come and do the ropes together. I mean, mom and gal also can come, just as a bonding exercise. So we are telling dad, do your gym here with your son at least once a week. Don't do it alone by yourself. Then spook spirituality, because so much of this have demonic influence, isn't it? Metaphysical influence. So how can Christian parents agree with this? And you should be in the forefront of advising other parents. Yesterday I was speaking to a father, very godly father. His son had eczema from very young days and a foot problem. So he couldn't get into physical exercise, and father used to work on the computer long. So out of love, the father would hug the fellow and keep him on the lap and do his computer work. So very early he got digitalized, and he began to write programs and so on. He's only 14 years. And that father said with great sadness, Dr. Lalith, sometimes I call him 10 times before he comes. And then he comes so nasty looking. I can see another person in his eyes. So he's a spiritual father. And because of this child's physical deficit, he could not get on to normal physical activities, and screen became his only thing he could do. So that was a sad product. So this is spook spirituality, the kind of airy-fairy mythology that goes on in the cartoons, the monsters, Game of Thrones and a lot of stuff like that. Learning, page 3, learning. So attention span and depth has to be improved. When you're on the digital screen and studying, your memory is less. You're not storing what you're studying. Secondly, you're not connecting it to other areas of knowledge, and in fact you should connect it to. Then your recall will be less. Your collation, at the end of studying a section, you must get a sense of, I know this well. That is collation, isn't it? As a whole section, I grasped it. You will not get that sense of grasping when you are studying on the screen. So I repeat, get it on solid screen, solid print if it's an important article, and just mug it up in the old-fashioned way. Underlining, highlighting, notes, that's what makes for memory. Recall, application, reproduction at examination, all are involved. A digital screen puts down all of that. That's the fact of research. So keep your reading habit lifelong. That keeps Alzheimer away. I have covered most of this. So thank you for being such a interested audience, because every time you interact, you learn, isn't it? You conceptualize again. So many times you ask questions, I had to rethink and learn myself. Thank you.